Welcome to the Mr. T and Healthy channel. Today, we're diving into an important topic during the cold season. Why does cold weather increase the risk of heart attacks? And, most importantly, effective prevention tips that you can apply right away to protect yourself and your loved ones. Let's get started. First, let's talk about why cold weather can be so tough on our hearts. When the temperatures drop, our bodies react in a way that's quite fascinating, but also a bit alarming. You see, one of the first things that happens is vasoconstriction. This is a fancy term for when your blood vessels narrow, especially those close to the skin. Why does this happen? It's all about conserving heat. Your body's trying to keep itself warm, but this narrowing of the blood vessels has a downside. It leads to increased blood pressure, which puts extra stress on your heart. Research from the American Heart Association shows that during the colder months, blood pressure can rise by about 5 to 10 mmHg. That might not sound like much, but when you consider the strain it puts on your heart, it's significant. Now let's add another layer to this. Cold temperatures stimulate the sympathetic nervous system, which is essentially the part of your nervous system that kicks into gear when you're under stress. This leads to an increase in adrenaline, which raises your heart rate and blood pressure even further. For those who might already have narrowed coronary arteries, this can be a recipe for disaster. It's like a perfect storm brewing, and if a blockage occurs, it can lead to a heart attack. But wait, there's more. Cold weather also makes our blood more prone to clotting. Yes, you heard that right. When the temperature drops, our blood thickens, and this can increase the risk of clots that block arteries. A study from Harvard Medical School found that heart attack rates can jump by a staggering 30% on days when temperatures dip below 50 degrees and 10 degrees compared to warmer days. Just think about that for a moment. On those chilly days, your heart is working extra hard, and the risks are elevated. Then there's the issue of sudden physical strain. Activities we often take for granted, like shoveling snow, jogging, or even just doing strenuous work outdoors, can dramatically increase the heart's oxygen demand. If your arteries are already partially blocked, this sudden demand can lead to ischemia, which is a fancy term for reduced blood flow. In simple terms, this can easily trigger a heart attack. And we can't forget about the air we breathe. Cold, dry air can actually reduce the oxygen levels we inhale. This forces your heart to work even harder to supply the oxygen your body needs. So when you combine all these factors, vasoconstriction, increased blood pressure and heart rate, higher blood clotting risk, sudden physical strain, and reduced oxygen levels, you can see why the risk of heart attacks increases during the colder months. Now, who's at a higher risk for heart attacks in this chilly weather? It's crucial to know if you or someone you love falls into one of these categories. Seniors, especially those over 60 years old, are at greater risk. People with a history of heart disease, high blood pressure, or diabetes should also be particularly cautious. Smokers, individuals who are overweight, and those leading a sedentary lifestyle need to be vigilant as well. And let's not forget those who work outdoors or are under high stress. They face unique challenges during the winter months. So, what can we do to prevent heart attacks in cold weather? There are several effective strategies you can implement right away. First and foremost, keep warm. It might sound simple, but layering up is essential. Wear multiple layers of clothing, especially covering your head, neck, hands, and feet. Scarves, thick socks, and thermal wear can make a world of difference when you step outside. Next, it's important to monitor your blood pressure and cholesterol regularly. If you're at higher risk, make it a habit to check these levels. If you notice any unusual symptoms, like chest pain, shortness of breath, or dizziness, don't hesitate to consult your doctor. It's always better to be safe than sorry when it comes to your heart health. Eating a healthy diet is another key factor. Focus on foods rich in omega-3 fatty acids, such as salmon and walnuts. These foods can help reduce inflammation and improve blood circulation, which is crucial during the colder months. On the flip side, try to limit your salt intake. Excessive sodium can increase blood pressure, which we already know is a significant risk factor for heart attacks. Moderate exercise is also vital. Engage in light indoor exercises to stay active and support your heart health. Activities like stretching, yoga, or even a gentle workout can be beneficial. However, it's important to avoid sudden, intense physical activity outdoors in cold weather. Your heart doesn't need that kind of shock, especially when it's already working hard to keep you warm. Managing stress is another crucial component of heart health. Stress is a significant contributor to heart attacks, and during the winter months, it can be easy to feel overwhelmed. Practice relaxation techniques like meditation, yoga, or even just listening to calming music. Find what works for you to stay mentally balanced and grounded. Hydration is often overlooked in winter, but it's just as important as in the summer. Dehydration can thicken the blood, increasing the risk of clots. So make sure you're drinking plenty of water to keep your blood flowing smoothly. It's a simple yet effective way to support your heart health during the colder months. If you have pre-existing heart conditions, it's crucial to take your medications as prescribed. Don't stop or adjust your dosage without consulting your doctor. Your heart relies on these medications to function properly, especially in challenging weather conditions. Now, let's talk about the early warning signs of a heart attack. It's essential to be aware of these signs, not just for yourself, but for those around you as well. If you or someone you know experiences chest pain or pressure, often described as a squeezing or crushing sensation, it's time to take action. Shortness of breath or difficulty breathing is another red flag. Cold sweats, nausea, or lightheadedness can also indicate something serious is happening. And don't forget about pain that radiates to the shoulders, arms, back, or neck. If you notice any of these symptoms, call emergency services immediately. It's always better to err on the side of caution. Now you know why cold weather increases the risk of heart attacks and how to effectively prevent them. This knowledge is power, and sharing it can help protect the health of your family and friends during the winter season. So if you found this information helpful, don't forget to share this video with those you care about. Let's spread the word and help keep everyone safe and healthy. And remember, if you enjoyed this content, please like and subscribe to the Mr. T and Healthy channel for more meaningful and informative content. Your health is your wealth, and taking the time to understand these risks and prevention strategies can truly make a difference. Stay healthy and safe.